Welcome to Healthy Pets, Healthy Owners. I'm Dr. Edmund Sulkowski, and Tucker and I would like to welcome one of my favorite guests on Healthy Pets, Healthy Owners, and that's Dr. Dennis Courtney. Dr. Courtney, welcome to Healthy Pets, Healthy Owners.
Dr. Edmund, thank you for the invitation.
It's always my pleasure. You are just a storehouse of knowledge regarding health. And you're an MD, but you do things a little bit differently than the average MD.
Outside the box, Edmund.
We can call it outside the box. We're both there. We both do it that way. You look at this root cause of problems and not just try to treat a symptom or a sign. And that's really what healthcare is looking at the root cause and attempting a cure, not a suppression.
That's correct.
So you do a bunch of different modalities in your office, and maybe we can get a little bit later on in the conversation talk about them. But I want to focus on something you've been doing for the past 3 years. You're a frequent guest on the radio show on AM 1250 that I have, Healthy Pets, Healthy People. And we've spread the word along with your lecturing that you do. And I am so shocked at the people that understand stem cells now. And that's the focus of our conversation today, stem cells, what they are and what they can do as far as the healing properties that they have for the body.
Love to talk about it, Edmund.
So Dr. Courtney, first let's start off as, what is a stem cell? What the heck is that? It sounds kind of cool, a stem cell, but what actually is it?
Well, look, these are cells that we can harvest that are blank, meaning they haven't yet decided what they're going to become.
So medically, that's an undifferentiated cell?
No, the technical word is undifferentiated. The common word would be a blank cell. That can turn literally into anything, but it has not decided to turn into just anything for now.
So it's a cell with no identity that can become a nose, an ear, skin,
any
organ,
in the body.
Anything. Bone, for example.
Absolutely, and we can harvest these cells, and we can administer them now in an attempt to try to deal with the health challenges of a lot of people and their issues. This is a very exciting form of medicine, probably had its origination back in about 2005. The title of this medicine is referred to as regenerative medicine.
Which is an appropriate name because you're actually rebuilding.
You're rebuilding and regenerating brand new tissue. But this concept of stem cells really isn't that puzzling because you have to consider one fact, and that is we were all, every single one of us, a cluster of stem cells in the initial days after our own conception.
Before an embryo was even produced.
There's about 3 or 4 weeks of time when we grew in our mother's womb, and a cluster of cells, none of them had decided to become anything just yet. At about the 4 to 5 week mark, however, embryological layers begin to develop and the decisions start to get made. But this issue about stem cells is the origination of us all. So it shouldn't be surprising to us that we can find these cells and harvest them and give them and essentially do what was originally done, only we can choose the health challenges that we want to rescue people from.
I want to talk about the different types of harvesting methods that are used and the different types of stem cells.
Sure.
But before we do that, what medical conditions would I be seeking these stem cells for to improve my situation?
The field of regenerative medicine literally cut their teeth on joint disease.
Which a lot of people have. Arthritis, injuries,
especially
athletes have issues.
Yeah, especially as we advance in age. Arthritic conditions of the joint is an all too common phenomenon. Our orthopedic community deals with these in the most definitive way possible. Ultimately, joint replacement surgery is what's on the agenda. These gentlemen do a wonderful job of replacing these joints, yet what we're finding out now is this is really becoming an unnecessary surgery.
So when you say replacing the joints, you're speaking of something artificial, whether it be titanium or plastic.
That's right.
Or sometimes even, are they using ceramic components now?
I'd say the big 3 joints involved are the knee, the hip, and the shoulder. Various companies use all sorts of materials, but the issue is at some point in the person's degenerative disease when all other options have been exhausted, and the patient is old enough. You have to be old enough in order to qualify for a joint, because the joints that are going to replace it can't hold up.
So in your lifetime, you have maybe 2 surgery possibilities of replacing a knee or a hip?
I'd say that if you show up at your orthopedics office at 50, you're too young to get a joint offered to you, that you'll have to make it for another 10 years at least, because the lifespan of an artificial joint, a synthetic joint, a replacement joint, is about 8 to 10 years, tops.
And then you're susceptible to infections in that joint, artificial joint?
Comes with any hospitalization, and certainly as we advance in age, our vulnerability puts an extra added amount of risk that maybe as a different time in our life we wouldn't have. Look, it's wonderful that the orthopedic world has this skill set, but what I'm finding is this skill is really becoming unnecessary, that joints can be rescued, can be regenerated, pain can be eliminated pretty substantially in a high percentage of cases with the use of stem cell.
So you're talking about the knee, the hip, and the shoulder. Other than location, are these joints different?
Well, all joints, no matter what the joint, have 2 bones that are meeting, and I like to use the knee because I think people can picture that. So we have this large bone on top called the femur, a bone on the bottom called the tibia. They meet. There's cartilage in between them. There's a membrane that surrounds the bone called the synovium. And to all that, we strap ligaments and tendons. And that is the consistency of any joint. 5 components.
So when a disease process happens, arthritis, for example, which is fairly common, that arthritis, that disease process begins to deteriorate those tissues.
And I have to say that I think all 5 tissues are always involved. I know patients come to me and say, well, I don't have any cartilage. I had a meniscus removed, or I'm told I have bone on bone, and
which I think is kind of impossible. But
it's an apt description. I think the medical community helps perpetuate. But the bottom line is, when you have a joint that has evolved to cause you pain and discomfort every day, all 5 tissues are intimately involved with that disorder.
And then with that process, disease process, you end up having reduction in synovial fluid, which is the bath that helps keep that
the
joint.
oil in the oil can is the synovium, yes.
Yeah. So when a patient comes to you, Dr. Courtney, are you really concerned that it was an injury from sports or someone that had fallen or arthritis? Is that really a concern of yours?
A very appropriate question, because I would have to say, in the use of stem cells, the diagnosis is unimportant. So if someone's knee is giving them problems because of osteoarthritis or rheumatoid arthritis or Osgood Slaughters, and the list goes on, the pathology turns out to be insignificant, because the code that's going to be read by the stem cell is going to be your DNA. And that hasn't changed since your own conception. And so if we're going to recreate new joints, reading that code is all that gets read. The pathology never gets read.
So that stem cell, that blank cell, will never adopt a disease cell identity.
It won't. It cannot. It can only perpetuate brand new and healthy tissue, and we hope all 5 of those tissues.
Mother Nature at its best.
Mother Nature at its best. And by the way, a comment should be, what took this so long? So many of our advances nowadays, and we're quite used to it, has been due to technology. And there will be more advances as time marches on with that technology. This particular advancement has nothing to do with technology, because it's biology. It's the way it has been since the beginning of time. Why it took all this time to get to this point is probably a question that I ask more than others, because really harvesting the cells isn't that difficult and administering them pretty easy. So this has been on the drawing board too long. Glad to see it's finally here, though.
So what is actually the procedure, the protocol when a patient comes to you for these stem cells?
Well, look, I recommend that everybody listening that whose interest may be piqued, and I think this is a very alluring topic. When somebody hears the term stem cell, they begin to imagine, geez, they say things like, I wonder if that could help and then fill in the blank. All the health challenges that could potentially fill in that blank are up for grabs here. But I caution the public, and I say to the public, look, don't move out in the arena trying to find the stem cells without educating yourself on how to shop for those stem cells.
Prior to becoming a physician, you were an educational teacher. You worked in the school system.
High school teacher.
So that has been your modality from the get-go. And actually the definition of physician is teacher. So you continue that in your medical practice, and every month just about, I know you didn't have one for the month of December, but every month you conduct seminars that are open to the public at no charge to educate people on what a stem cell is, what the disease process is, and what the stem cell can do about it.
And how to shop to know that the product is their best product to do the job.
So that would lead into explaining the differences in the types of stem cells and how you use that word harvest. Mm-hmm. I need you to explain what that means, because you're not getting them from a cornfield.
No.
So would you do that for us?
Look, when this all began back in the early 2000s, the source was only one, and it was you. We call that group of harvesting autologous, because literally the patient donated either their fat or their bone marrow, and then they extracted the stem cells from those body fluids and administered those same stem cells back to the same individual. That made the person both the donor and the recipient all rolled into one. It's the way it was. It was as good as it got, and it was where we all started. We have really transcended that rudimentary beginning now. So the autologous world, and probably the first caution I would have to the listeners of us today, would be autologous may have been wonderful in 2005. It is not the best way to do stem cells. And today, within the last 6 to 8 years, a new player is involved. We'll call these homologous cells. And these are cells that come from other human beings and then are administered to us. We harvest them from those human beings and we deliver them to a different human being.
So what other human beings are you getting these cells from?
We have one source. It's the proper source. These cells are all obtained from babies delivered by a scheduled C-section in mothers who have been screened for health issues. These are full-term babies. They are healthy babies. There's no issue here with, I understand the public concern about aborted fetuses. That does not play a role in this at all.
When you use the word baby, you're not harvesting the cells from the baby itself. You're harvesting the cells from amniotic sac, umbilical cord, placenta.
At the time of delivery, the newborn baby at that moment of delivery is seething with stem cells in their environment. And so we harvest and take the organs, the placenta and the umbilical cord, and the companies that get involved with processing take those organs back to their home base, and those organs are processed to extract the stem cells, to be able to freeze the stem cells until the day comes when I actually call up and say, send me a vial, small vial, 1 milliliter vial.
That's that much.
One milliliter, which I'm guaranteed to have no less than 10 million cells. So we are getting the voluminous number of cells.
The interesting thing there is those 10 cells begin to divide. So at the end result, you're doubling those cells each time they divide. Am I right?
Well, let's use that knee as an example back again. Let's move back to it. So we talked about what constructed a knee joint. understand that all 5 of those tissues are enveloped in a sheath, a capsule. And once we penetrate the capsule and deliver the stem cells into the capsule, they can't escape. Those cells are trapped in
They're
that
locked
capsule,
in there.
and they're going to randomly land on one of 5 things.
Or all 5.
They'll land on all 5 in a random fashion, but upon landing, they declare. Remember, they haven't declared just yet.
Meaning they now assume identity.
They are going to declare to become a brand new and healthy one of whatever that happened to be. If those that land on bone are going to destine to become bone, and only bone. Once the decision is made, you don't go back to the blank stage anymore. From that point forward, you can only divide. The divisions happen about every 3 to 6 weeks. So we say that 10 million randomly landing on those 5 structures is going to double every 3 to 6 weeks, meaning 10 million go to 20, which go to 40, which go to 80, and so on, until a critical mass gets reached that literally allows the regeneration of a brand new joint when prior there was a diseased joint.
And that can happen over a period of months, that happens.
I think it's safe to say, too, that about 6 months is, I think, the call the question time. Because by about 6 months, what the benefits are at that point, I believe will be the sum total. But that usually is such a large improvement that people are very happy with where they are.
Because they get out of pain, number one, and that's really what drives them there.
It's what drives them there. I can tell you that the idea of having a joint replacement has been the ultimate solution. But it's by the time it comes around and gets offered, people really do get concerned about that surgery.
Well, you know, I have a couple people that I know that I referred to you, and you ended up doing stem cells. I mean, there have been many people that I've talked to about what you're doing, but 2 in particular had shoulder issues, and they were lined up to have surgery. One had surgery on a previous shoulder, and when you saw them, and it's hard for me, I don't know if you can see this on TV, but they had no range of motion whatsoever. And just the other day, this one person was doing this with no pain, completely free. The other person that I know that had the same, your protocol done with the stem cells, says the best investment I ever made. And he was set up to be a patient for surgery, to have an artificial joint.
Look, these surgeries are wonderfully, they've helped so much. But to think that what I've been seeing is that really the surgeries are becoming obsolete. I don't see the need for many of them at all.
And your protocol, your procedure is minimally invasive. All you're really doing is numbing the surface of the skin and inserting a little needle into that joint.
Sure. I mean, doctors who are treating these patients with joint disease oftentimes do steroid injections on the way to getting to the ultimate solution, which is the joint replacement, or they use a Halgan, which is rooster comb, sort of the padding, and administering that and entering the capsule for stem cells is exactly the way it was to do any of those other procedures. They take just seconds, but by putting in those cases, drugs, and in this case, stem cells, miraculous things can happen.
What's the difference between stem cells and PRP?
Very good that you brought that up. PRP has been a procedure available to me as a medical doctor for years now. PRP stands for platelet-rich plasma. And what this is a fraction. When somebody comes to the office, we take a blood specimen, 36 cc's of their blood, distribute it into 6 test tubes, put the 6 test tubes in a centrifuge,
spin it,
spins it around really fast. After about 10 to 12 minutes, the layers separate out. All the cells go to the bottom of the test tube. The clear fluid comes to the top, and a little line of demarcation marks the interspace between. The area of the plasma just above that, it really is a compressed area of white blood cells, is very rich in growth factors and cytokines and has some amazing healing properties. And so these procedures have been done for a long time now, and they can be quite helpful.
But they're kind of temporary.
I think the point I probably would like to make is if anybody's getting PRP, there are absolutely and positively no stem cells in PRP. So as long as it's being promoted as something that really isn't stem cells, I'm okay with it. It could be quite helpful.
You know, I'm always talking health. It's like, you know, don't get me on my rampage about being health and being well and things you can do to improve your overall conditions. So it's easy for me to have a conversation and get on a rampage about something. So one day I was talking to someone, and they told me, she said I had stem cells in my knee, and I went, "Where did you go?" And she started to talk, and I said, "What was the procedure like?" Well, she was describing PRP.
Oh, she was having PRP.
Yeah, in her mind it was stem cells, and then I kind of explained to her, you really didn't have stem cells,
no
you
stem
had
cells.
PRP. And she was a little bit surprised to hear that, but she said it relieved my pain, and I'm jogging again.
We're thankful for all those benefits.
And I personally had some PRP done for eye condition, and when I was doing the PRP, it improved my eye problem.
Okay.
But the issue was, you know, you're constantly having to have blood drawn, have that spitting process, get it to the lab to be processed, the pharmacy to be processed, and it was expensive. You know, I think when I first started doing it, I think it was $1,700 a month for me to have the PRP done.
Yeah, and because there are no stem cells in it, the results could be just short-lived, and you'll have to go back and do it again. Thank goodness we have such a procedure that could give you maybe even the temporary relief that you got. But stem cells, I find, are definitive. This is like one and done, and I love to be involved with
and
solutions.
It is pretty
like
much one and done. One injection, one time, and you see the results.
And we see those results.
Does it ever take a second injection?
I've had, now, at this stage of my career, the last 3 years, about a little over 400 patients. I've only had one of those that ever asked for a second injection. And the reason why it was asked for is after the first injection, he had low back pain. He was 50% improved. He was quite thankful for that. But he said to me, doggone it, I want the other 50. And we repeated the injection, and thankful to see, because it was the only time I've been asked to do it, he got his 100%.
Now, I don't know this gentleman, but he did call in on Healthy Pets, Healthy People
he did.
radio
He called
show
us.
and explained what he did and how improved he is after
That's
the
right.
second injection. Yeah, so
Yeah.
It was,
One time.
he was extremely thankful.
Yeah.
And I think, was it Canada he was in at the
He
time
was
he called?
from Canada.
Yeah.
He was a product of their medical system up there, and he was involved in a motor vehicle accident in 1991. I met him a year ago. It's 27 years. He's in the same situation.
Are you too young to have this procedure done?
What do you mean?
If a 12-year-old injures their knee in sports-related and it's permanent damage, can I, as a 12-year-old, have stem cells done?
I believe you can and should. I think that we talk a lot about the aging population and the degenerative diseases, but we should not avoid talking about the younger individual who may have athletic injury, because our young athletes oftentimes, especially in sports like contact sports, oftentimes are exposed to terrible blows which end up causing body parts to need to be removed, replaced.
Torn medial meniscus removed, broken kneecap repaired, you know.
Here's where I think surgery, and this is a good general rule to follow, should always be the last resort.
Absolutely.
And if we can put this in that perspective, then what is the preceding potential? It, I believe, should be stem cell.
You have your monthly lectures. You educate people. You tell them the do's and the don'ts. And you're actually not even trying to solicit them as your patients. You want them to be educated so that they have the knowledge to ask the proper questions. So we have numbers that are going up on the screen for anybody that wants to make a reservation, because you do need a reservation for this free lecture.
Okay, so go ahead. Do you want to say something?
But what I want to say something, could you just give us maybe a little inkling of a few of the questions that people should ask their physician?
So I call this lecture, now famous lecture by the way, Stem Cells 101. That's a very appropriate title because any kind you get into the educational system, your first course in anything is called a 101. I mean, there's English Lit 101. Well, there's Stem Cells 101. And I believe it's the best primer that I could ever put together to take an uneducated consumer and in 1 hour make them completely able to understand how to make the decision in which stem cell to allow to be used.
You and I call that empowering the patient.
I absolutely do.
Yeah.
So I give these lectures monthly. Look for them. You can call my office. I know there's a number.
The number will be up on the screen.
And we can tell you when the next one is. However, if you wanted to go and listen to that webinar right now, it's on my website so that you don't have to wait for the next lecture. The entire thing is on my website. If you just go to courtneymedical.com, on the opening page, 6 divisions of my practice come up. One of them says Stem Cell Solutions. Click on that. They're just a couple of keystrokes to get you into the webinar.
You really will want to attend the lecture. It is engaging, and you just walk out there with such knowledge, and I think it motivates people to then investigate. You know, this show is going to air in December here at the end of December, and it will air in January. Your lecture is Monday the 14th of January, your next lecture, and then you have your eye protocol the following day on the 15th. So they are free. You just need to hold a seat, make that reservation.
Give that number on the screen a call so we can reserve a seat for you.
Dr. Dennis Courtney, we are at the end of the show. I want to remind everybody that I generally have Dr. Courtney on around the first or second Saturday of every month to talk about his stem cells on my radio program, Healthy Pets, Healthy People on AM 1250 The Answer. And that's at 9 o'clock every Saturday morning. The reason I'm mentioning that is here, this is a recorded show. People can't call and ask you questions. On that radio show, you have the opportunity to do just that.
Good
So
thank
stay
you.
tuned into that. Dennis, thank you so much for coming on
Thank
Healthy
you for
Pets,
the
Healthy
invite,
Owners.
Edmund. Thank you.
You know, Merry Christmas and a Happy New Year and a Happy Hanukkah. Remember, a healthy pet is a happy pet. When you're healthy, you're happy too. We'll see you next time on Healthy Pets, Healthy Owners. Thank you, everybody. Wonderful show.